about case report forms, and we know that case report forms are so important for our data collection, for our clinical trials, and we'll look at outline the CDM focus on protocol review and how to identify data requirements. And I know that a lot of times in our careers, we don't necessarily, especially when we're starting out in data management, we don't necessarily get some good training on what to look out for in the protocol as far as what the data collection requirements might be. We'll also implement best practices for eCRF design and discuss the need for customization of CRFs, discuss the CDASH standards for data collection in case report forms, and identify data compatibility issues and solutions to ensure appropriate data integration. So there's a few things that we'll be covering today. And so when we look at the definition of the case report form, and we see that it's a record of the data and other information collected on each subject participating in a clinical trial as defined by the protocol. I think most of us are more, let's say, familiar with the ICH definition, which speaks to the printed, optical, or electronic document designed to record all of the protocol required information to be reported to the sponsor on each trial subject. A working definition would be the tool designed by the sponsors to capture the transcription of protocol-specific subject data from source documents. And last but not least, it says CRFs are based on the study protocol. And it's very, as I said earlier, very important to identify those data points that we need to capture. So the purpose of the CRF is to answer the hypotheses formulated in the study protocol or the objectives. And we look at the CRFs as well as to collect the relevant safety data related to the drug. Every study that we conduct, except perhaps for, let's say, a study for publication, but I'm even thinking that those still look at safety data. Phase 1 studies may be healthy volunteers where we're looking to see if tolerability of the drug. We may be looking at adaptive studies where we look at increasing doses and things of that nature, but we're looking to answer the questions that we have in the protocol. The protocol is the experiment in which what we are going to perform and how we are going to prove our hypotheses. And it will be our case report forms that will ensure the precise collection, collation, analysis, and reporting of the data. So we want to ensure that the CRF requests the precise information that we have in the protocol, requests only the information required by the protocol. And this is where a lot of the times data management gets pushback from, let's say, our clinical operations colleagues on the study team. We want to request that information that the completion of the information is simple, relatively quick, and unambiguous. We have to think of the end users when it comes to the CRF. And how is the study coordinator at the site going to be able to follow the instructions, follow the flow, along with the visit assessments that they have to do. And it presents information clearly in a logical sequence to facilitate interpretation, an easy interpretation by the data entry staff. I remember when I joined Sanofi Pasteur and we were conducting studies on infant vaccinations, there was a case report form that was for the study, and I had no idea what was supposed to be collected on that form. And as a data manager, if I had no idea, I can imagine what the sites were doing. And of course, it was a real sore point when we had a lessons learned meeting to really take ownership for the fact that that form's design was quite awful. So we want to ensure that the CRF presents the information to allow the investigator to review it to ensure that the subject is still eligible to belong in the trial, looking at protocol deviations and violations. We also want to phrase the question and order the sequence of assessments to minimize the number of queries. And this is where, when we talk about electronic data capture and the eCRF, the functionality of those forms really facilitates many of the things that we've had to deal with if we were using paper. And we also have to ensure that this case report forms have been accepted and owned by the members of the study team. Everyone needs to be familiar with them. We as data managers have to really interact with biostatisticians to ensure that the data that we are capturing is in the format that they are anticipating to utilize in their statistical analyses. We want to ensure that our clinical operations folks understands the questions, the types of data that we need to collect, and why we need to collect it.